why is it important to clear phlegm, and why is it important to have good ability to cough? Well, this is simply because that clearing phlegm is very important in preventing infection and preventing the lung collapse. So when infection or the phlegm is unable to be cleared and the lungs gets collapsed, there is a higher risk of getting lung infection, or also known as pneumonia. Are you or your loved ones affected? It all depends. You have to be assessed and tested for it. Is there a way to get tested? Well, yes, definitely. So first of all, the MND has to be diagnosed by a neurologist. You need to get a neurology or consultation, have to be referred to a neurologist. Then subsequently, your ability to, or your loved one's ability to cough properly and clear phlegm can be tested by several ways, which we have objective instruments or equipments to test it. Along with the symptoms that we actually hear from the patient. Is it treatable? Yes, definitely. It is very much manageable and treatable. Okay, what are the treatment options? Well, first of all, the patient has to be, patient and the family, or you or your loved ones, need to be educated first. Okay. Second of all, we need to teach the patient and the carer, in this case, usually the family member or close friend or anyone who actually has been hired to take care of the patient personally, in terms of how to take care of this. And how do we go about it? Usually, first of all, we do teach how to use a suction device, okay, to remove the secretions, okay, or the phlegm from the mouth. But most importantly, we usually teach one of the two of the following techniques. The first technique is lung volume recruitment with manual assisted cough, okay, and the second technique is the MIE or the manual insufflation exsufflation. How to use it is a device, the MIE, and we will usually teach you how to use it on the patient. Okay, so why do MND patients drool? Okay, as the disease progresses, the muscles, many muscle groups in MND patients actually deteriorate or weakens. So there are two important muscles which are involved here. The first muscle, which is the swallowing muscles, and the second muscles, which is the muscles around the lips that helps the lips close. So in this case, when the saliva collects in the mouth or the oral cavity, it is difficult for the patient to actually swallow it. And on top of that, the patient is unable to close their lips sealed very well, and due to that, the saliva drools. Okay, why should drooling be treated? There are several reasons why. The first reason is simply because that this is severely distressing to the patient. Some of the patients actually feel that this is very, very embarrassing, and that causes a lot of them to actually shun or avoid social interaction. Yes, this it also causes a lot of frustration and in the patients as well. So it improves the quality of life once the drooling can be treated. Second of all, it actually helps improve hygiene. A lot of times the drooling actually causes the dirtying of the t-shirt, okay, the neck, all right, the chest, okay, and sometimes causes really a lot of discomfort in terms of being very cold around these areas as well, and around the mouth as well. The third thing is that drooling should be treated in especially patients who has a problem in breathing, or what we call a ventilation problem requiring non-invasive ventilation, or what we call it a BiPAP, okay, which they are on a machine to help them breathe, especially at night. So when the drooling is not managed properly, then putting on the mask, okay, would be difficult, which is one of the important parts of getting patient to have an adequate ventilation at night. So because of that, then patients tend to actually have to remove the mask, wipe it again and put it back on, and because of that, that affects the NIV and also the sleep quality as well. And when we are sleeping as well at night, there is higher risk of aspiration, or what we call as the accidental swallowing of the saliva into the lungs, which presents as an increased risk of lung infection as well. Where should I get further advice? And tests. The MND disease, of course, requires a neurological consultation and further battery of tests by the neurologist. However, for the drooling, can be referred to a neurologist or rehabilitation physician who has experience in it. So what are the treatment options? So first of all, we are unable to actually improve the strength, swallowing strength, and the lip seal strength. However, what we can do is we try to actually dry up the saliva production. So how do we do that? First of all, we have this drop called an atropine drop, which we put it under the tongue. So that's the first option. Second option is if that doesn't go well, we can actually try out with a patch. Basically, it's called a hyoscine patch, which delivers the medication through the skin into the bloodstream. If that doesn't work, we have some tablets, oral medication that might work, such as amitriptyline. And if that still doesn't work, probably we will consider a local injection of botulinum toxin under ultrasound, under direct ultrasound guidance. Okay. And last but not least, there are other options as well, such as radiotherapy and surgery. However, this is still not so widely available in Malaysia.
So we'll follow on with some videos to show how we can do some breath stackings and exercises.
Okay. Another way to improve phlegm clearance and cough is by performing what we call a lung volume recruitment. So this is a lung volume recruitment equipment. Okay. And basically what it does is that it is applied to the mouth, and this technique, which is called a breath stacking, basically we are stacking breaths on top of each other to improve the lung volume. And later on, this is followed by manual assisted cough to help the bringing out of the phlegm, which we will actually demonstrate following this. Yeah. So, okay. Yes.
1, 2, 3. 1, 2, 3.
So every time after inflating the bag, the patient will stack the breath. Okay. And this is a manual assisted cough to be done by physiotherapists or trained home care providers.
So this is the video recording on cough assist done by the patient.
This is an example of how the manual insult is actually. This is a Philips Respironic cough assist, which is the common manual insufflator exsufflator that we usually use on the patient. This is an example of the setting that probably we might actually perform or set for the patient. So I'm going to demonstrate an example of how a patient who has the upper limb capacity to perform on himself. Usually this is performed a few times and a few cycles until a patient has actually achieved a good amount of clearance of the phlegm, and this is usually followed with suctioning of the phlegm either by the patient himself or the carer, the family member.
This is by the helper.
So this is an example of the manual insufflator exsufflator or the MIE being done by the family member or caretaker. So usually there will be either one or two assistants, one person to maneuver or to play around with the screen setting, and the other person to actually put on the mask and to support the patient's posture and the head. So yeah.
So someone supporting the head, and once the machine is on, it's auto triggered.
Usually this is followed with clearance of the flank by introducing a suction catheter right after that.
So today we're going to demonstrate in a very brief video how to put on non-invasive ventilation or BiPAP for patients with motor neuron disease. And as been demonstrated in the previous video, this is a BiPAP machine, one of the brands that is available in the market. This is the humidifier that is attached to the machine, and there is a tubing that is connected to the machine at the back. The setting up of the machine will be handled by your home care provider, and the prescription will be given by your doctor. So this will be set up before you use your machine. So now we're going to demonstrate the wearing of a mask. There are two types of masks generally that is available in the market. One is the oral nasal mask, or full face mask we call it, because it covers the nose and the mouth. The other type is the nasal mask. So nasal mask only covers the nose, and the preference of the mask depends on the comfort of the patient. So now we're going to demonstrate the use of how to put on a oral nasal mask.
Alright, so first of all, I can actually just put this over. Alright. Okay. Or another way is initially putting the mask first. Okay. And then pulling the strap behind. Okay. To make sure that it fits snugly. Okay. And then you can actually bring down both the other straps down and just connect over to the blue dot over here. Same thing over here. Okay, and then after that, you can actually connect this with the tubing, okay, which is connected to the ventilator, and the ventilator, the BiPAP machine, can actually be switched on and can be initiated.
So now we're going to demonstrate how to put on a nasal mask only, and making patients comfortable, and also trying to adapt on the BiPAP machine.
So the way to put on the nasal interface is to firstly gently place it on the patient's nose, and then just gently slide the strap around the back of the head. And after that, place the straps towards the front such that they snap onto the mask, and do fit the straps just snugly but not too tight. So once the mask is in place, you may connect the tubing to the NIV machine, and once the tubing is in place, you start the machine, which is going to be set on a setting suitable for those patients, especially when starting to get used to this machine, at a setting that is low and usually easy for the patient to get used to the machine while using the nasal interface.
So once again, thank you for your time watching this short video that we have prepared for you. We have roughly shown and demonstrated how to put on BiPAP devices and how to wear the mask for the patients.
Hopefully this has been educational for phlegm and drooling issues in patients with MND.
If you need any further information, please don't hesitate to contact MND Beyond Borders through either Yayasan ALS Indonesia, the Tan Tock Seng Home Ventilator Respiratory Support Service, or MND Malaysia.
Thank you very much for your time. Bye-bye.
Hi everyone, my name is Dr. Su and I'm one of the respiratory doctors who manages patients with motor neuron disease. This is a short video clip that we have created together with MND Society of Malaysia in order to help patients or caretakers with motor neuron disease to understand the condition a little bit better and how to cope with patients with respiratory symptoms. So the short video clip that I've created here is divided into two parts. The first part, we will explain a little bit on how the motor neuron disease affect your breathing and your respiratory system. The second part, we will give a little bit of explanation on non-invasive ventilation, or some call it as BiPAP therapy. So a lot of times when patients with motor neuron disease or ALS, when they are referred to see a lung doctor or respiratory doctor, I get questions that come to me as to why a neurologist referred to see a lung doctor, whereby my symptoms are actually weaknesses of my hands and weaknesses of my legs, and my breathing is entirely fine. So the questions that always lies in the mind of our patients is, does MND or ALS actually affects the lungs and the breathing itself? So let's go to this simple diagram. This is a diagram that shows the muscles of the lung. So if you look at the diagram over here, for a normal person during normal quiet breathing, the principal muscles that involves or help in your breathing, that's involving the intercostal muscles, which is the muscles situated in between your ribs. And at the bottom of the lung, you have a big bulk of muscle which called the diaphragm. And this, together with the intercostal muscles, they work hand in hand to provide the respiratory pump, we call it, to help you to breathe in and also breathe out. And if you are doing some form of exercise, if you're out of breath, and when the principal muscles are tiring out, then the accessory muscles, that is some muscles at the neck, will actually help out in provide this breathing. So when a person has motor neuron disease, the muscles that are affected can also involve these respiratory muscles that I've mentioned earlier on to you. And that brings us to the question of hypoventilation. And this is fundamentally important to understand, because patients with motor neuron disease or ALS, when their respiratory muscles are weak, they will develop hypoventilation. And when patients come to me, when they ask, what do you mean by hypoventilation? In a very simple manner, I will tell them, explain by very shallow or very slow breathing. So imagine how does hypoventilation happen. Imagine when your muscles are weak and it starts off during sleep. So while a person is at sleep, there will be reduction in your awake state. That means your breathing is entirely dependent on the muscles that I've mentioned to you, especially your diaphragm and your intercostal muscles. And during sleep as well, there is loss of muscle tone. That means technically the body is at rest. So when the muscles are weak, it will be under strain to cope with the demands of the body. Thereby, you are unable to sustain an adequate ventilation. Therefore, there will be shallow or slow breathing, especially during sleep. So at the early phase, patients with motor neuron disease will experience hypoventilation during sleep. As the disease progresses, if there's no treatment being provided to them, then the hyperventilation state will also involve daytime. And at that stage, patient will experience symptoms like breathlessness. So how do I know if I'm affected by hyperventilation? This is a common question that patients do ask. Some of the symptoms that we always advise patients to monitor themselves, do they really feel sleepy in the morning? Do they feel tired? Do they feel unfresh after even having 7 to 8 hours of sleep? And sometimes some of the patients may wake up feeling heaviness in their head, feeling headache. All those are symptoms that should be monitored. In fact, even having a very poor sleep quality is one of the early symptoms that suggests the patient may have hyperventilation. So apart from symptoms like I've mentioned, okay, when you are being referred to a respiratory doctors, we will carry out a series of tests to help to determine whether you will have some form of hypoventilation or whether you are at a higher risk of developing hypoventilation. This will involve a lung function test, we call it. That means a test to check the strength of your lung function and how strong you are able to blow through testing of your respiratory muscles. And on top of that, sometimes we will also would do a test to check the oxygen levels and carbon dioxide levels through some blood tests. Through a combination of tests like the lung function or the respiratory muscle strength measurement, or perhaps the carbon dioxide levels in your blood, okay, and plus minus symptoms, we are able to formulate a diagnosis to inform you that whether you would have hypoventilation. So upon diagnosis, if you are concerned that you may have hypoventilation based on symptoms that I've mentioned earlier on, or you have been told by your neurologist or any other doctors to seek further advice or information, I would encourage you to get in contact with us through this email, mndmalaysia@gmail.com, so that they will arrange a suitable neurologist or suitable chest physician to assess you further. So as I mentioned earlier on, how is the test being tested? So upon coming to see a respiratory doctor, generally in the clinic, we will ask your history. We ask chronologically, how was the progression, how was the symptoms. After a history from you, we will carry out a quick examination to check your respiratory, your muscle strength of your limbs. We will also examine your lungs, and follow that, as I mentioned earlier on, we will carry out a lung function testing. Together with the lung function testing, we will also test your respiratory muscle strength in terms of how strong you are able to inhale and how strong you are able to exhale. There are some other tests to be carried out as well. For instance, like how strong you are able to cough and how well you are able to swallow, whereby this will be explained by doctors who are in charge on swallowing and clearing of secretion. So once patients come to us, and if any of these results suggest that the patient has hyperventilation, is there any treatment for it? And what if treatment is not being provided? This is what if the patient chooses not for treatment for a time being. So the established treatment to help in hypoventilation is what we call non-invasive ventilation. So what actually is non-invasive ventilation is a assisted ventilation that is being provided to you non-invasively. That means it's through a mask, not through a tube. And at the early stage, it's only used at night during sleep. Some of the people actually call this as NIV, and some of the people use a normal term that you may heard of called a BiPAP treatment. The treatment itself, I will explain further during part 2 of my talk. Thank you for your attention. Hello everyone, and this is part 2 of the video clip that I've promised in continuation from the part 1 that I've just presented earlier on. So part 2, we'll be talking briefly about what is non-invasive ventilation and what does it comprises of. Okay, so let's start the ball rolling, and to make things very simple, basically non-invasive ventilation, or some people call it more commonly as BiPAP. So BiPAP itself, it comprises of few components. This is the machine that you see. I'm just going to move it a little bit back so that you can see. So this is the machine that you can see, and this is where the extra component that is attached to the side of the machine. This is a humidifier. Then you have the this is a wire socket that connects to the AC power. You have the tubing over here. This is the tubing that connects to the back of the machine. And of course, you have various types of masks available. Okay, so why is it called non-invasive ventilation? It's important to understand. It's because the ventilation, assisted ventilation itself, is provided through non-invasively. That means it's through the mask, either through the nose that is covering the nose, or the mask covering both the nose and the mouth, that we call it full face mask, right? It's different from invasive ventilation, whereby patients in the intensive care unit, ICU, those sort of ventilations, you will require a tube to be put into the windpipe of the patient. Now back to BiPAP or NIV, non-invasive ventilation. So this is the device. Once you have powered it on, okay, it's important to be aware of this humidifier. You can actually open it as shown here. So there is a marker. So fill it up with some distilled water up to the marker that is recommended. Close it nicely and slid it into the machine until you hear a click sound. Okay. Once it's fitted in nicely in this way and the power is on, ensure that the tubing is connected at the back well, and this tubing itself will go to a mask that the patient or you yourself prefers. Most important, it's the mask that you want to wear is the mask that you find comfortable with, and you need to go through a series of testing and adaptation, and this can be advised by your doctors or even the home care providers that come along with you, because there are various types of masks that is available in the market that you can actually test and try it out. So I've actually brought along here with me 2 types of masks, and it's a common available mask in the market, common category. So the first one, as you can see, this is a nasal mask. Nasal mask means that the mask will cover just the nose. Okay, so various brands have various design. It's important to be aware of, and sometimes the clipping mechanism is different based on the brand that you are trying it out. So how does it go? It's
this mask will be fitted on through your nose, just like this. Okay, hopefully we'll have a video to demonstrate to you how fitting can be done for 2 person. Okay, if you are having some weaknesses over your hands, you're not able to do it yourself, you need assistance, we will have another video to demonstrate to you. Okay, once this has been fitted on, just like this over the nose, you should be breathing through your nose, and also there can be some form of leakage through the mouth. This is the usage of a nasal mask. Okay, and why some people prefer this is because it's smaller, and if you use a nasal mask, you are able to speak because the mask itself doesn't cover your mouth. And this is the part whereby you connect through the tubing, right? Just shown like this. Okay. Now, on the other hand, an oral nasal mask here, it's the mask that it covers the nose and the mouth. For instance, in this way, if I can show. Okay. So the clipping mechanism or some design in different manner depends on the brand itself. Once you have connected to it, for instance, I've showed previous just now, the tubing connects at the bottom. This way. Okay. So different mask suits different people. It's important to be aware that no one mask is the best mask. Okay, the best mask to me is the mask that you find yourself comfortable with. And a lot of time for BiPAP therapy, I will always advise my patient or try to explain to them that you will need time to get adapted. It's not something that you can get used to it after using for 30 minutes or 1 hour. Sometimes you can do it at a short periods frequently initially for 1 hour, for 2 hours, but you need to get adapted over time, right? So we are done with the mask and the machine itself. So in terms of the setting of the machine, you will not need to know in detail, but basically each machine is different. There is an on-off button here that you can see. This is the on button. Once the on button is in, then you have a knob that you can change the setting of the machine. This way, okay. So there are various settings in them that you can actually change. For instance, like how strong is the pressure, what's the humidity level that you prefer, what's the comfort settings. But all this will be advised by your doctors or your home care providers. So once you have used the machine, you just need to press the same button to switch the machine off. And somewhere over here, if you're aware, there is also a SD card that stores the data or the usage of the machine. And some of the new machines like this one, it's linked to a cloud software. So the results can be traced via the internet. It's very much more convenient for your doctors to check your results. And not forgetting, there's a filter as well at the back of the machine. There's a filter at the back of the machine where you won't need to know, but your home care providers will advise you accordingly when to change the filter and when to actually check on the filter. The last but not least, all these machines are very durable. You should use it according to the advice of your doctors or the advice of your home care provider.
One of the question is, patient do ask me, how frequent do I need to service the machine? Recommended is every year you can contact your home care provider where they will come and collect your machine and do a quick service for you just to ensure that they are functioning well and optimal for your treatment. Last but not least, it's important to know that BiPAP therapy is an established therapy to help in hypoventilation. So for patients with motor neuron disease, usage of BiPAP has been demonstrated to improve overall quality of life, median survival. It also helps in slowing down the deterioration of your lung function. So there are many papers or many studies that has been done and demonstrated that BiPAP therapy is useful for patients with motor neuron disease. So I am hereby strongly recommend to you that to seek early consultation or early advice from your neurologist or from your respiratory physician as to whether if you are diagnosed with this condition, whether you would need to be started on non-invasive ventilation. With that, I thank you for your attention, and I hope that if there's any questions, you can direct your questions to our MND Society of Malaysia. There is an email that is going to shown to you so that we will address to any concerns that you have. Thank you very much for your attention. Have a good day.